Okay, I'm Zailey Clement from Web City, Missouri, and I have pain in both sides of my jaw, but it's worse in my right side. It lofts open if it was too far, and I have pain in my bottom hairline since I was like 12 or 13. I'm 17 now, almost 18. I did a lot of like heating and cooling to try to like help with inflammation, and I try to eat softer foods so I wouldn't, work my jaw as much. I'd say a 7 or an 8, but whenever I eat, sometimes it can get up to a 10, depending on what I'm eating. Or if I'm singing or something in the car, I don't really do that as much anymore because I can't, sing as well. I had to go get an MRI done with a doctor at one point for that little bit. And he said that I'm going to move my work foot forward because they had flipped it back. And so he said move them forward. And then he was going to cut both my bottom and upper jaw and put spacers in there to move it out. Probably my headaches. So I have good and that go all the way up my ears into the back of my hairline and in my temples. So it started when I was like 12 or 13. I'd have headaches every once in a while, but within like the past 2 years, I've had like continuous headaches. And sometimes they'll wait for a few hours and they'll come back. And we'll just be continuous and get worse and dim down. And then they'll get worse, and then get better. So, but it never goes away 100%. Well, normally I'd say like it's by the middle of the end of the day, but sometimes it gets worse by how much I use my jaw, and it hurts in the back of my neck. Probably my neck and shoulder pain. Because like when I look up at my screens at work a lot, it hurts really bad, and I can't turn my head very well, and I get really bad pain in my shoulders where it's like hard to reach up and grab things, and lifting things is really hard, especially whenever I lose my balance and stuff, because I don't do good with that either. And that's been happening only within like the last year. That hasn't been a very big thing until here recently. Probably like a 5. It's not too bad unless I'm doing strenuous activity, in which case it would hurt really bad in my shoulders and in my neck, to where it's like I feel like I gotta pop my neck constantly. So, and my shoulders pop like it just did. I don't know if you can hear it, but
overall, I've been doing a lot better. Pain-wise, headaches have gone down a lot. I haven't had as many like balance issues. Since I had left this in too long, it's starting to come back, but whenever we first had it in, it was fully done. It actually made a lot of difference. Now it's not as bad. I can actually eat full meals without, I was so bad I was crying, not able to do anything. Now I can eat full meals, and I do get worn out. Like I think it gets tired, but it doesn't hurt as bad. So probably like an 80%. I've noticed that it's been a lot less painful. I don't get worn out as much. I can actually eat full meals and stuff like that. So it doesn't
What's the
hurt.
percentage change before to now?
Okay, so it's been a 90% before, and then now that I've kind of worn it out and worn it a little too long, it's probably come back to like an 80. Honestly, mostly they just aren't every day. They haven't been constant like they were before. I had constant headaches. When the orthotic was still perfect, it was I rarely had headaches. Probably about a 70 now since I left it in too long. My neck pain's been a lot better, as long as I don't like pop my neck and do crazy things like I do. Hasn't been as tender.
Better.
Hasn't been as tender, and it hasn't been throbbing as much as it did before, causing the headaches. I think that is a 70%, I would say, because I still do have some symptoms, but I don't know if they're all jaw related. Balance is definitely better. I would fall over a lot, especially like when I was playing with my dog. I'd run into walls. My wall proves it, but I have been able to get around and not run into things and trip over things as much as I used to. Probably about an 80% as well. Overall, it's made a lot of improvements.